My name is John Fetting. In recognition of October as Breast Cancer Awareness Month, the Fetting Fund for Breast Cancer Prevention is releasing to its website short educational presentations on important breast cancer issues. We hope you find them informative. Welcome to our presentation on breast density. I am joined by Emily Ambinder, an assistant professor of radiology at Hopkins and a specialist in breast imaging, and Danielle Gilkes, an assistant professor of oncology at Hopkins and a basic scientist whose research aims to determine the causes and effects of breast density. Emily and Danielle, thank you very much for joining us and welcome.
Thank you.
Thank you.
Before we even get into breast density, let's deal with something that's even more basic. What tissues do we find in a woman's breast? Now, I'm not talking about the skin now. I'm talking about under the skin. What tissues are in a woman's breast?
Sure. So I'm going to show you a breast biopsy. And just to give you some perspective, this breast biopsy is on an order of magnitude of the size of a piece of rice. And what you can see here is epithelial tissue in purple, shown here as well as here. And these clusters of purple cells are what produces milk. And in the purple cells, you can see a duct, and these are small tubes that will deliver milk to the nipple. So this is an important constituent of the breast tissue. What we also have is stromal tissue. This fibrous connective tissue shown here in blue contains collagen-producing cells, and these cells are known as fibroblasts, and this provides support to the breast. Lastly, what we have is fat tissue or adipose tissue, which surrounds and fills the spaces between the fibrous connective tissue, and that's all shown here. And so these are the three main constituents of the breast, with the fat largely determining breast size.
So the size of a woman's breast is more related to the amount of fat she has in her breast than the stromal tissue or the milk producing and carrying cells. Is that right?
Yes, so let me tell you a little about what breast density is. So it's basically going to be a ratio. So we're not just considering fat, but we're also considering that epithelial and fibrous tissue. So here I'm just showing you a ratio. In the breast, the fibroglandular and fibrous tissue are considered sort of the dense elements in the breast, whereas the fat is considered a softer element. So if you think about it, the more fibroglandular tissue you have relative to the amount of fat, the higher the density of the breast.
So is the size of a woman's breast equivalent to density, or are they different?
It's different. So the more dense elements you have to the more soft elements you have is what is going to be determining your density.
So a woman's breast, a woman with a small breast could still have a very dense breast.
Definitely.
And a woman with a very large breast, it may not be dense.
That's correct.
Emily, how do these tissues, the glandular tissues, the fibrous tissues, the fat, what do they look like on a mammogram? Something you're looking at all day, every day. What do they look like?
This is an example of a mammogram, and I'm showing those same two elements that Danielle spoke about earlier. So on a mammogram, we have the fatty tissue, which looks dark gray, and I have this arrow pointing at it. And then the fibroglandular tissue, we see kind of all together, and that looks white on a mammogram. So you can see that the breast has a mix of that dark color and the light color, and those are the two elements that make up the breast tissue.
And Danielle had told us before, Emily, that the fibroglandular tissue is what results in breast density. Is that right?
Yeah, so I wanted to show some more examples. So this is a patient with about middle breast density. When we talk about breast density, we break it down into 4 separate groups. So we have the not dense categories, which include almost entirely fatty and scattered fibroglandular densities. And then we have the dense categories, which are heterogeneously dense and extremely dense. And I think it's helpful to see the 4 categories so you can see what we're talking about when we're actually looking at a mammogram. This is an example of a mammogram with almost entirely fatty breast tissue. And you can see the breast tissue is almost all that dark gray color. As we go up in density, this is a patient with scattered fibroglandular densities. We're seeing more white on this mammogram. It's still mostly that dark gray color, but we're seeing more of that white spread around it. When we get into the dense categories, we're seeing even more white compared to the dark gray, representing that fibroglandular tissue. And when we get into that highest category of extremely dense, almost all of the breast tissue is that white color with very little interspersed fat or dark gray in between it. I have another final slide just showing the 4 categories next to each other that I think really helps to visualize what we're talking about with these 4 categories, with the fatty breast being almost all that dark gray color, and then all the way over to that extremely dense where the breast is almost all the white color.
Thank you, Emily. That is very helpful to have a picture in our mind's eye of what those words mean. With this by way of background, let's switch into consideration of issues related to breast density and breast cancer. Danielle, I've heard that there's an association between breast density and breast cancer. Could you explain that, please?
So yes, higher breast density is one of the strongest independent risk factors for breast cancer, but that's for women with extremely dense breasts. They have about a 4 to 6 times greater risk of developing breast cancer compared with those women whose breast contains mostly fat. And this is true even after you adjust for age and body mass index. So dense tissue, in addition to that, also makes it harder to detect cancers on mammograms, which could lead to later stage diagnoses.
Emily, you had just shown us 4 different degrees of breast density, and we just heard from Danielle that extreme breast density increases the risk of breast cancer 4 to 6 times. Emily, do lesser degrees of density also increase the risk? What do we know there?
Yeah, even patients with heterogeneously dense breasts, that's that 3rd category, have a slightly increased risk of breast cancer compared to average.
How about the scattered fibroglandular densities and the almost entirely fatty? Do they have an increased risk of breast cancer?
At those levels, that those patients would have a risk of breast cancer based on other risk factors, but density would not be one of the factors that would be increasing their risk factor. They may have other factors that are increasing their risk, but density would not be one of them.
Danielle, you talked about the relationship between breast density and breast cancer. That I think you phrased it as it increases the risk of breast cancer. Let's push it one step further. Can breast density be thought of as a cause of breast cancer? And if so, how might it happen?
I think that this is really an area that requires a lot more research. But what we do know is that dense breasts contain more epithelial cells and more stromal tissue. So therefore, if you have more epithelial cells, those cells, the ones that I mentioned before that are important for making milk, you also have more cells that could eventually transform and become cancer. Emerging research is also showing a connection between a stiff and more collagen-rich microenvironment being associated with more aggressive cancers. And that's because they sort of promote a faster cell growth, and then they allow those cells to become more invasive, so that the cancer could invade into healthier tissue. We also know that stromal fibroblasts, those cells that create that fibrous tissue, secrete more growth factors. And so I tend to think of that dense tissue. I'm going to show it here as a sort of sponge here. And then these growth factors that can attach to this fibrous dense tissue and perhaps feed the normal epithelial cells that are generating this duct that eventually it would eventually produce milk, and cause these cells to transform and become more like a cancer cell. But again, this requires much more research. And we also know that dense tissue shows increased sensitivity to estrogen and progesterone. So this can also extend hormonal growth signals too.
So let me just retrace your steps there. So the gland here has cells that are lining it.
Mhm.
Is that right? And those cells are the epithelial cells you're talking about. And it's those cells that give rise to breast cancer.
That's correct.
Okay. And the glandular elements, the cells that are going to give rise to breast cancer, are surrounded by fibrous tissue. And that fibrous tissue, the analogy you use there is it's like a sponge. And it is it's like when you squeeze it, out come these growth factors, which can promote changes in these epithelial cells that can lead to cancer. Is that right? Is that the hypothesis?
You absolutely had it right.
Emily, how does the breast density affect your ability as a mammographer to detect a cancer? Does breast density make that more difficult for you?
Breast density makes a huge impact on how we read mammograms. And that's because breast cancers are usually white on a mammogram. And as I showed before, those dense breast tissue have more white tissue, which can obscure a cancer. I'm showing here a patient that has almost entirely fatty breasts, and she does have a very small breast cancer. I'm going to circle it here so you can see it. It's a pretty subtle finding. If you can imagine, if this patient had more of that white tissue, that fibroglandular tissue, we would not be able to find that cancer. But because she had mostly fatty tissue, that's something that we're able to see. We're able to make this call, have her diagnosed with this breast cancer when it was still very small and very treatable. I'm going to show another example. This is a patient with very dense breast tissue. You can see almost all of the breast tissue is that white fibroglandular tissue with just a small amount of interspersed fat. This patient also has a breast cancer. We were able to find it, but I think just looking here, I think it's just so much harder to see. So I'm going to circle it. This is where her this is where her breast cancer is. We were able to detect it. This is a much larger cancer than the one I showed on the prior screen. I think this just really shows why we have a harder time finding cancer in patients with dense breast tissue. And the numbers reflect that. So in patients that don't have dense breast tissue, we do an excellent job finding almost all of the breast cancers on mammogram. In patients that have very dense breast tissue, the sensitivity of mammography drops significantly, in some studies as low as even 60%. So we know that dense breast tissue definitely impacts how well we're able to find the breast cancers on a mammogram.
I think the fact that we have excellent breast radiologists looking at this allows us to get to 60%, because I think lay people looking at this would not even see it at all. So that's impressive. But it really does obscure the borders of the mass.
One of the biggest improvements in mammography in the past 10 to 15 years has been tomosynthesis, which is, I think, often known as 3D mammography. And that's very helpful in finding these types of cancers, especially in dense breast tissue, because when we scroll through and we see the breast in more of a 3D picture, it can make these cancers really become much more obvious than on a 2D picture like I'm showing you here. And this was a 3D mammogram, and I think that those 3D images is what really allowed us to detect this breast cancer, for example.
Emily, a follow-on question to this is, how does a woman know the density of her breasts? We talked earlier, and it's not related to your size or but how does a woman know that she has dense breasts?
Yeah, so it's a good question, and you won't know your breast density until you get a mammogram. There's no way to tell just by how your breast looks, how your breast feels, what size it is. It's really on a mammogram what the ratio is of fat to fibroglandular tissue that we can see. As a patient, the way that you'll know is that in many states, including the state of Maryland, we're required to include it on that lay letter that you'll get after you get your mammogram. So there will be specific language that's required for us to inform you whether you have dense breast tissue or not. And that will be in your letter that you'll receive.
Is there some kind of language that patients may look for in that letter that is kind of the code to what their density is?
It's very clear. There's specific language actually on our current letters that we're sending from the Maryland sites of Johns Hopkins. We have two different statements because there is a national language requirement and there's a Maryland language requirement. It'll say very clearly whether you have dense breast tissue or you do not have dense breast tissue, and that the reason that we're telling you is because dense breast tissue is associated with breast cancer and it can decrease the sensitivity of mammograms.
Following on to that, Emily, if a woman reads in her mammogram report that she has dense breast tissue, does that mean she has extremely dense breast tissue, or?
Yeah, that's a great
Go
question.
ahead.
The way that it's currently required is just to group patients into the two different halves, whether people fall into the not dense or dense. And so the not dense being the almost entirely fatty and scattered fibroglandular density group, dense being the heterogeneously dense and extremely dense group. So you could be either. We see about 45% of patients are in that one of those two groups. In the lay letter, it doesn't necessarily include which of those two groups you fall into. That's not required. The letters that we send from Johns Hopkins, we do include which specific group you fall into.
I see. And you said something 45%. That 45% fall into the more dense categories?
Into the one of those two density groups.
Okay. So more than half of women don't have dense breasts.
Yes. But I do when I tell people that they have dense breast tissue, I say you're in good company. I mean, 45% of people are in this group that we're talking about. So while it does increase your risk, it's not, a rare thing that we're seeing. We're seeing this in almost half of women.
I understand that as a woman gets older, her breasts get less dense. How does that come about? What happens there?
It's mainly due to hormonal changes. So after menopause, estrogen and progesterone will decrease and no longer support that glandular tissue that we were talking about, those epithelial cells, and no longer support that stromal remodeling. And that might be due to the fact that we no longer need that glandular tissue to drive milk production. Eventually, fat will replace the glandular tissue and stromal tissue. And just as everywhere else in our body, as we age, collagen production also decreases. And so that stromal tissue in our breast will decrease, and that will lead to lower density. In support of this, we know that hormonal replacement therapy is strongly linked to maintaining breast density after menopause. So this kind of tells us about the effects of estrogen on breast density, both positive and negative. So it's thought that postmenopausal women with persistently high breast density are at particularly elevated risk for breast cancer.
That's an important point you make. So with menopause, the estrogen levels decline substantially, and women will often have health problems related to that, and sometimes will consider hormone replacement therapy, either estrogen replacement or estrogen plus progestin. And what you're suggesting is that the replacement therapy can foster the continuation of dense breasts. Is that right?
That's correct. Yes.
If breast density might be a cause of breast cancer, why don't we just try to eliminate breast density? What can we do to make a woman, other than have her go through menopause, what can we do to help a woman reduce the density of her breast? Are there any drugs that are approved for this, Danielle?
So another active area of investigation. We know that patients with premalignant conditions, like, for example, atypical hyperplasia, or those who have a very high lifetime risk of getting breast cancer, those women have taken drugs that block estrogen signaling, as you're talking about menopause. And so those drugs such as tamoxifen, raloxifene, and different aromatase inhibitors, we know that those reduce the risk of breast cancer and simultaneously reduce breast density. However, it's not known whether one is causative for the other. So it's not known whether the reduction in breast density is really the reason for reduced breast cancer incidence. So, and currently in the clinic, and you can correct me if I'm wrong, but these medications are not indicated to reduce breast density.
You got it right. They do reduce the risk of cancer in patients with those premalignant conditions that you mentioned, like atypical hyperplasia, but they're not approved to treat women with just dense breasts. This, as you say, is an area of investigation. Emily, what do you recommend to a woman who receives one of these letters that says that she's got pretty dense breasts?
Yeah, I think it's a good question. I get this question a lot. I think one thing I want to emphasize is that you should still get a mammogram. Mammograms are really the foundation of breast cancer screening, and they're the only imaging tests that have been proven to lower your risk of dying from breast cancer. But I also would recommend that you talk to your doctor about your personal risk factors for breast cancer. Breast density is one risk factor. That combined with other potential risk factors like family history, your own personal history, and other potential risk factors may increase your overall lifetime risk of breast cancer enough that it would make sense for you to also get a supplemental imaging screening test. That's generally most commonly an MRI, which we recommend for people that have a lifetime risk of breast cancer over 20%. But there's a current studies and a push for people that have even just a slightly increased over average risk of breast cancer that there's a benefit for those groups. Or ultrasound screening. So MRI and ultrasound are the two other imaging tests we use for screening. And those are not as affected by breast density in the same way that mammography is.
If a woman has extremely dense breasts, would you recommend an MRI be added to her imaging?
I would. I think right now a challenge that we have is that insurance companies won't necessarily cover MRIs if the only risk factor is extremely dense breast tissue. And that's why we don't come out as a recommendation at this point. I will say there has been a few randomized clinical trials showing that there's a large benefit for patients with extremely dense breast tissue because we know that the sensitivity of mammography goes down, and then we'll find those cancers on MRI. So I think that we're in a shifting period right here. We're already seeing more MRIs for people that have dense breast tissue as their only main risk factor being covered. And I think in the next couple of years, it'll probably be more standard. But right now, it's not a blatant recommendation because I also recognize MRIs are a very expensive imaging test. And we also it's a limited resource. We don't have enough of them right now to recommend for every woman with dense breast tissue. But with every woman with extremely dense breast tissue, we probably do, at least in our community here. We're lucky.
I know as a medical oncologist, I would push for MRI. As you say, the insurance companies may not agree with it, but I certainly think it makes sense. Thank you very much. This has been incredibly informative. This breast density is such a widely discussed topic these days, and I think you all have really helped clarify what it is for people who are looking at these videos. Thank you again. And thanks to everybody for watching.